Hey all, welcome to this month's Benefits Talk. My name is Jessica Dubois and I am an employee benefits consultant here at Risk Strategies. Now, before I introduce today's topic and co-host, I first want to provide you an overview of what Benefits Talk is. So I decided to create this LinkedIn Live series because I know that there are thousands of vendors out there and solutions that employers can implement into their employee benefits program. My goal is to provide you an introduction into the solutions and partners that I've already vetted, that I've had success with, and that I currently utilize in the benefit programs that I advise employers within. Now, the other part of this is that I like it to be valuable, but also quick and simple. So we keep it under 30 minutes. Then at that point, you're able to ask your questions in the comments box. You can go ahead and do that throughout the presentation. But also it allows you to reach out and say, hey, I want another conversation, and we can do that. Now I'll go ahead and introduce today's topic, which is Captives 101, how captives can be a catalyst to lowering healthcare costs while increasing plan value. And I'll also introduce today's co-host, which is my partner, friend, and captive expert, Eddie Castro. Hey, Eddie, how's it going?
Hey, good morning, Jessica. When Jessica invited me to this and said we're going to be talking about captives and we only have 30 minutes, I kind of freaked out a little bit. So I did drink 3 cups of coffee this morning, and hopefully that'll get me through this. Again, as Jess said, my name is Eddie Castro. I'm the regional practice leader for Roundstone. We're a group captive managing general underwriter in the market. I've spent a better part of 25 years working with employers and their advisors, really talking to those employers and figuring out, what is the best way to transition from fully insured to self-funded, both in the P&C and now the benefits space. So never a dull moment.
Well, thank you for that. And I'll keep you in line. Eddie told me he had 3 cups of coffee and it scared me a little bit. So I'll let him know if he's talking too fast. You let us know in the comments box too. And if you're here, feel free to say hello in the comments. We want to know who's here and who's joined us today. Now, Eddie, first thing I want to ask you is, employers have been used to captives on the property and casualty side for years. It's only, I feel like in the last 5 to 10 years that captives have become really common on the healthcare side. I would love to hear your perspective on why the trend is increasing.
Yeah, that's a great question. And the truth is, and we hear this all the time in the marketplace, most businesses feel trapped by the rising cost of their healthcare spend. And what captives and Roundstone, who I represent, bring to the market is a unique solution that controls costs for those employers and returns a savings back to them. There's a lot of reasons why the popularity is growing in captives, but I've brought it down to 5 main issues that is in the marketplace as far as benefits. A lot of these employers have lack of transparency. They have lack of control. And when we talk about control, we're talking about plan design options, cost containment, cost mitigation opportunities. They're frustrated with the double-digit increases and typically with little to no justification as to why some of these employers are getting those increases. And they're tired of the merry-go-round of constantly looking every 12 months and shopping for carriers and jumping from one carrier to the next. They're looking for long-term stability, something they can, hitch their wagons to and go for the long term and not have to, reinvent the wheel every 12 months. And, quite frankly, the fully insured option, we need it in the marketplace because not everybody's a good fit for a captive. But, employers are realizing that, when you have a 100% fixed cost solution with no potential for dollars return when you perform well, there had to be something else out there in the marketplace. So, you brought up a slide here, Jessica. I love this slide because it really speaks to the frustrations that employers are having. If you're looking over a 10-year period here, you have workers' earnings. I don't know if you can see the color graph here, but the dark blue line here, that's workers' earnings. 26% increase over the last 10 years, not too shabby. But when you're looking at a 54% increase, the green line that you see there in family premiums, that's frustrating, right? And so what employers are having to do is raise deductibles. And you can see that's the orange line here. Your deductibles are, you can see how high those are going because employers are having to offset those costs by increasing the cost of their employees. This could be increasing deductibles. This can be watering down the plan designs. These are all the conversations you have, Jess, with your clients on how do we continue to offer great benefits, but do it in a way that it's affordable to our organization.
Yeah. And that becomes even more important over the last couple of years as employers have tried to retain employees and attract them, right? And we know healthcare is like the number one priority or thing that an employee looks at when they are transitioning jobs, right?
Yeah. Exactly. So, one of the other, employers today have really three options, when they're considering their healthcare spend. They three main things. The reality is three things. One is this is a top three line item on any P&L, sometimes top two. So this is a big deal for your small mom and pops, your mid-sized organizations, the ones that are trying to expand, the ones that are trying to keep the doors open. Those to be the ability to control this cost is a big deal. If they do nothing, if they just stand pat, and the old saying, the definition of insanity, doing the same thing over and over again, expecting different results. As groups are getting double-digit increases year over year, issue number two here, current costs will double in 4 years. Make it 6 years. Still, is it sustainable for the long term? Is that something that the employers can continue? Are they running out of runway? And that's what we're hearing in the marketplace is most employers are. I talk to government contractors in your market that are just like, hey, listen, Eddie, I only am allowed a 3 to 5% increase in my fees every year. So, when I get a 10 or 20 or 30% increase from the carrier market, I can't hire more people, which means I can't bid on more business. This definitely impacts those businesses in that sector. And this is not just unique to government contractors. This is unique to anybody, right? And then the last thing here is, and I think one of the biggest thing, and the I call it the price of admission. This is worth the price of admission, is zero reporting to analyze these increases, especially if you're a group under 100 and fully insured. You have no information. I challenge any C-suite person on this call. What other line item on your P&L are you spending $500,000, 750, $1 million, and not know what you're spending your money on? If those three things don't frustrate an employer, then we might not be the solution for you. That's all I could say.
Yep. And we know this past year, if you're looking at the numbers, employers saw the largest increase that last year in healthcare costs and what they've seen over the past decade. And if we look ahead, I was reading through Risk Strategies State of the Market report. Check it out. It's on their LinkedIn or mine. And it talks about the expected increase for this year for 2022. We see it was 7 to 8% on medical, 8 to 15% on pharmacy, and that just continues to increase. And then also 15 to 20% on stop loss. So they're looking for some type of strategy to help with these volatile increases, right?
Yeah, absolutely. We see, in the past, when I first started here, it was an 80-20 split, medical to RX spend, right? 80-20 is what we see. I've seen a 70-30 split for all of my groups in this past renewal cycle, meaning RX, your prescription drug costs, are rising, and they're rising fast. So once they're catching up to the medical spend, which should be your big bucket, right? The problem with the fully insured option is you don't have transparency to that. You can't fix a problem that you don't know, what the issues are. You have to figure out where you can push and pull the levers and push the right buttons. I call it unlock the toolbox to be able to implement certain strategies to help mitigate those costs. And that's where having good partners in place really plays an important role.
Yep. Well, before I ask you what to talk through captives, I first want to take a step back because we've talked a little bit about like self-insured versus fully insured. And I just know that there's some people on here who maybe are in a fully insured plan and maybe they don't know the difference between fixed and variable cost, which I know you're going to go into a little bit. You're going to say those words while you explain captive. So I just want to make sure we talk through this. If you are in a fully insured traditional plan, you are paying the same premium every single month per employee, and all 100% of that is non-refundable. It's a fixed cost. You're paying the same thing. At the end of the year, you're not getting anything back, and you're almost 100% guaranteed to get a renewal. On the self-insured side, which captives are a version of a self-insured plan, you have your fixed costs, which stay the same each month, but then also your variable costs, and that varies month to month, right? It's in the name. For the fixed costs, you have your administration fees, just like you do in a fully insured plan, but you also have stop loss premium. And that stop loss is there to protect you against high cost claims. And that's where Roundstone will come in, or a captive solution will come in. On the variable costs, this is the benefit to a self-insured plan. And the reason why is because your claims costs, the goal is to come in, spend lower than what is expected or max, and that money stays with you. And you're typically going to see a lower increase because the increase that you're going to get is going to be on the fixed cost, not on the claim side. So with that, I just want to do that quick refresher. But with that, I just want to switch back over to you, Eddie, and say, what is a captive?
Yeah. So, what is a captive? In short, some call captives large buying group or group purchasing. You'll hear the term consortium or cooperative or pooling. At the end of the day, a captive is a pool of employers banding together to spread risk and reduce the cost of their medical spend. The best way to illustrate what a captive is, quite frankly, is to show what it's not. And I have on the screen here 3 different options for employers. And I'm going to go right to left because I'm a little dyslexic. So we're going to go fully insured first. In the fully insured market, which is what most employers under 100 have been told for years is really the only reasonable option for them, it's 100% fixed cost, as Jess just pointed out. You're scratching your check for $500,000 a year, $1 million a year, and you're done. So sometimes I jokingly say that's the easy button, right? And quite frankly, I don't want to villainize them because, as I mentioned earlier, not everybody's a good fit for a captive. And our underwriters will determine that with your advisors to determine if it's a good fit or not, a good year to come into the pool. But for those groups, the challenge is that it's 100% fixed costs. And when you have those good years, the insurance company is keeping all the profits. They're not cutting you a check back at the end of the year saying, hey, you had a great year. Here's your refund. I love the slide before you said non-refundable programs. That's essentially what it is. It's a non-refundable program. So these employers have gone to their advisors and said, what other options are out there in the marketplace? And you see even the carrier market come to the market with level funded or partially self-funded programs. I mean, even if we're talking about traditional, spec and ag, traditional self-funding where you have high deductibles. Here, you're lowering your fixed cost from 100 to maybe 40 up to 60% on some of the level funded deals. The group gets some control, some reporting. So that's a good first step into looking at the self-funded arena. But this is where the employer assumes 100% of the volatility, because when they have that bad year, they're the ones who get hit with the brunt of that bad year, right? There's no risk sharing. There's no risk spreading. There's no group buying opportunity there. So you hear the horror stories of a group jumping into self-funding and getting hit with a 30 or 40 or 50% increase. And guess what? They go back to fully insured. That's not really a long-term solution. So what Roundstone did is we created this group captive, right? Approximately 15, at most I've seen 20% fixed costs. The group gets full control, full transparency, all the things we kind of talked about, the challenges that the employers have. Well, we provide solutions for those challenges. And what it means to have 80 to 85% variable spend means more opportunity for the group, the employer, to keep money in their own coffers. That's the biggest advantage of the captive, is creating more variable costs in a safe area where you're not self-funding what I jokingly refer to on an island by yourself. Now you're with a pool of like-minded employers that are all doing this for the same reasons. They're looking to maximize their spend, maximize their opportunities to keep costs variable, and maximize their opportunity to keep dollars in their own coffers so that they can invest in their own businesses, hire more people, offer better benefits, reverse the clock and lower deductibles, do all the things that we talked about earlier.
And I appreciate that. I see there's 2 types of employers that might be watching this and maybe wondering whether it's a good fit for them. I see on one side, you may have a smaller, mid-sized employer that doesn't like the risk aspect, or the other side where you have an employer who is already self-insured and just outside of a captive. So I'd love for you to talk through the parts of a captive, like how it works. So I'm just going to skip ahead here. And if you could go through like how it works.
Absolutely. So we've broken it down to 3 different, I call them buckets. So we're going to call them buckets in this presentation. So we have 3 different buckets. You have your risk taking. This is the blue bucket, right? This is where your employer's paying claims out of this bucket as they occur. You're not pre-funding claims, and it's very similar. I would call it very similar to traditional self-funding in this way, that the claim bucket, that's your risk taking. That's what the employer, when I'm talking to an employer, I say, you know what, pay yourself first. Put this money in your bank account. You're not giving it to the carrier. If you don't have claims that month, nothing comes out of your account. By the way, this often represents 50 to 60% of the total spend of the plan. So this is your opportunity here, your risk taking. That's what the employer is paying from $1 to whatever their what they call specific deductible is. That's per member. Okay, then you have your risk sharing, and this is your captive layer, your pool. The captive is going to be paying claims between that specific deductible to 500,000 in our solution. So the stop loss is paying those claims. So again, the employer is still protected for those large specific claims that could happen throughout the plan year. And then you have your risk shifting. So Roundstone, as an MGU, we partner with carriers that protect us for those large catastrophic claims above $500,000. So you have that protection, that umbrella coverage, if you will, for those large spec claims that could happen in the market. So I like this graphic too. It really depicts where the money's going. We talked about the buckets, right? So I'm going to refer to the buckets again. Your big blue box here, that bucket, this is your claim account. So this is your employer-held account that the employer is going to fund on a monthly basis to pay for claims as they happen, right? And we don't dictate how you fund this, how you budget this. This is all based on the group's specific risk, and you work with your advisor to determine how you're going to fund it, how you're going to work this portion out. The benefit of this is whatever isn't spent in this big blue bucket is essentially kept 100% by the employer. And as I said earlier, that represents the largest opportunity for savings in this type of solution. Now, I always say this isn't unique to self-funding. That's any self-funded program out there that's traditional self-funded. In level funded, sometimes you'll see that the carrier might keep 50% of what's left over. In our solution, the employer is keeping 100% of what's left over in claim bucket. Again, huge. What does make us unique in this market is what we're doing in the stop loss, right? So in this example, the employer's stop loss specific deductible is $10,000 per member. The employer's paying every month 1/12 of their specific and aggregate premiums to the third-party administrator who sends it to Roundstone. And what we do at Roundstone is we're taking about 1/3 of that stop loss, and we're going to give that to the nation, one of our two stop loss carrier partners. And by the way, they happen to be Nationwide and American National Insurance Company, both AM Best A-rated companies. So this is that orange layer, that reinsurance. You're covered for those claims above $500,000, those specific claims above $500,000, right? So you have that umbrella coverage. Then the 2/3 that's left over of the premium, we're dropping that into the pool with all the other like-minded employers. And the benefit of doing this, and by the way, 2/3 going into the pool, is more of your fixed dollars are now made variable, because it's not 50-50. It's not, it's 2/3 of your premiums now made a variable cost, because what isn't spent in this green pooling layer comes back to the employers in the pool pro rata based on the percentage into the pool. So, this is very different. In other self-funding solutions, this is all one big orange band. In our solution, we take 1/3 of it. I tell employers, you're not getting a penny of that back. That's a fixed cost. That's the cover you for the rainy day. But the 2/3 of the premium that does go into the pool, that has an opportunity to come back to you in what we call a captive distribution or underwriting profits. That would come back to each group that is in the pool pro rata based on their percentage of premium into the pool.
Yeah. And I've seen it to where for a couple of groups that I know I have in the captive, their plans didn't perform that well, and they still got money back from the captive.
Yeah, that's a great question. I get employers all the time. Well, what happens if we're the train wreck year, Eddie, and we have a terrible year? What happens? We don't get any of that money, right? Wrong. The benefit of the pooling is that you can have that train wreck year and spend every red cent in your blue claim bucket, but still get money back because you're in this pooling environment. What happens more times than not, though, is the groups actually save money in their claim bucket and get money back in unused stop loss dollars. We'll call it that, right? Your captive distribution at the end of the year. And why we call this volatility protection for year-over-year renewals is that, as Jess pointed out earlier, you're getting a renewal increase based on a small percentage of the total spend. And when you factor in the money that you didn't spend from last year's plan and you roll that over to this year's, and any captive distribution stop loss dollars you're also getting back, we're not even talking about any PBM or pharmacy benefit manager rebates that you could potentially get back. That's where the smoothing comes into play. And that's where really that's why smaller and mid-sized employers can do this type of thing. is that they have there's these different, the mousetrap is built for them to come in and benefit from some of these features that they're able to get some money back at the end of the year.
Yeah. Well, an employer might look at this and say, oh my gosh, how do I keep track of all of these different payments that are going for Roundstone and the administrator and the advisor and all these different aspects of the plan? The good news is you don't have to. Just like you pay for if you're in a fully insured plan, just like you pay premium every single month to your insurance carrier, that's the same thing that's going to happen here, except you're going to pay it to an administrator. And that administrator then is going to allocate those dollars toward Roundstone, toward the captive, as well as the other parts of your plan. So yes, it's important that you understand how the captive works, but you are not going to have to keep track of where all the payments are going within the captive, right?
Yeah, and that's a good point. One of the things that I often get questioned from employers is how do we? It sounds like there's a lot of vendors here. There's a lot of moving parts and pieces. One of the things Roundstone realized many years ago is we've got to make this easy for the employer. We got to make this easy for the advisors, right? So, Jess, you've seen our proposals. We bring the stop loss together with the third party administrator, with the network that we're going to access, with the pharmacy benefit manager. We pull your advisor fees in, and we put together one simple proposal that you can deliver to your group to say, here's your costs all in. And by the way, we compare to your fully insured equivalent. So you can see apples to apples, mirroring the same plan design. What is this plan going to cost me? Worst case scenario, I call it zombie apocalypse number, and best case scenario. And actually we say expected. Oftentimes our groups run about 6% better than expected. So, you can see that there's a lot of variable costs here. We're not Nostradamus. We have no idea what you're going to spend. We can tell you what your worst case scenario is. And we can say, hey, if you budget for that or somewhere around there, but spend less, you keep the difference.
Exactly. Yes. I like that. And I'll also say, like, another question that we get is how is it going to look to an employee? And so that's why I wanted to add in this slide of the member experience. So the plan can look identical. And actually that's what we typically do, right, Eddie? Like, we take their current plans, as long as that's what makes sense for the organization, at least the first year. Let's just keep the plan design the same. It can feel the same to the employees. They can have an ID card that has their network on it. It's going to look and feel just like the same plan that they had prior. The benefit, though, and this is the reason why I love groups going self-insured, is that we can customize it. And you see the customization there on the bottom right-hand corner. I just put in some examples. We can add in a pharmacy solution if you have someone taking one of these high-cost prescriptions, which I guarantee you do, and it's impacting your renewal. You can add in that customized fertility benefit that employees are wanting right now, or virtual care, which we saw a great need for over the last few years, mental health services, direct contracts. We can do anything within these plans, whereas you're going to be very limited in the experience that you provide under a traditional plan.
Yeah, I joke all the time. I'm like, my wife, we're in the captive at Roundstone. We believe in our own product. She has a white laminated card. It has a Cigna logo on it. She has no idea she's in a captive. And most of your employees will never know you're self-funded in a captive. The C-suite will get it. And typically it takes about 18 months for the employer to have the aha moment that, oh, okay, so everything is pretty similar. And if we control our claims, we control our cost. Because the stop loss portion and the fixed cost, it's not the big part of the cost here. Your big cost is your claims. So if you control your claims, you control your costs. And as we kind of hammered home already, you can't control your claims if you don't have information. So I think that's where having that data, and then having partners like Jess, like Roundstone, where we have a CSI team, cost save. I call it jokingly CSI Cleveland. So our CSI Cleveland team will look at the data that's coming from the third-party administrators and make recommendations when it makes sense. We don't mandate these cost containment solutions. We take not a penny from these solutions, but when it makes sense for the employer, we're going to make recommendations, because ultimately, if we save the employer money, it does two things. One, makes for a happy customer because they're paying less dollars, and two, makes for a happy Roundstone, because those claims don't get up into our layer where we're paying those claims. So there is a collaborative effort for us to all work together to help mitigate costs.
Okay. And I'm going to remove that, but let me know if you want me to bring up another slide. But the next question I have is, who is a good fit for a captive?
Yeah, that's a great question. So, we've worked with employers, 25 to 1,000. So that part is, we're very flexible there. But our sweet spot tends to be that 30 to 300 space. Because quite frankly, you get over that, you're probably looking at traditional self-funding. And most advisors that might be on this call would agree with me. You start to look at, okay, now we're looking at not a 25 or 35,000 specific. We're looking at, 250,000, 300,000 specific. So that's where we tend to lose groups. And again, not because it doesn't make sense. We do have some employers that like the protection, the volatility protection, the ability to get some of their stop loss dollars back. But anyways, that's the size. Groups that are frustrated with the things we talked about, the lack of visibility to this top three line item, P&L item, the groups wanting to keep 100% of what's not spent, groups looking to get off that merry-go-round, the long-term solution concept. So this is a concept sell. You're talking to employers that have to get off the 12-month cycle where they're looking at changing carriers every 12 months and really hammer home that this is not something you want to dip in and dip out of. But we virtually work with any industry in the marketplace. But I would say most importantly, you have to have a good advisor like Jess that understands this, that understands what solutions to plug in when it makes sense, because it is a partnership. You have your third-party administrator, you have our CSI team, where you have us, Roundstone, the stop-loss team, but then you have to have an advisor that meets with the groups on a regular basis to go through some of that reporting. What's good is the reporting if nobody's doing anything with it, right? And most employers that are fully insured have never seen reporting, so a 35-page report isn't going to do anything for them. So you have to have, that cooperation, that engagement with your clients to meet with them, to work with the Roundstone team, to work with the third-party administrator team to help, create the solution that makes sense for the employer.
Yeah. Well, and I'll add to that and say, let's look, it's less about who your industry and who you are as an organization. And it's much more about, I would say, your openness and attitude about healthcare costs. So if you are open to the conversation, if you're going to sit down and analyze the costs and learn about a captive or self-funding, that makes you a great candidate, right?
That's a great point. Yep.
And I want to, we only have a couple of minutes here. If anyone has questions, please type them in. But I want to go through, how do you evaluate captives as an option? And the first thing I will say is, like, please try to not do this, after you get your renewal. We can do that, but I would recommend, this is what we're in March. If you are 1/1 renewal, evaluate it now, update it in a few months, and then see if it makes sense to switch for your 1/1 renewal. Try to look at it in the off season, because then you can have a few meetings, learn about it. You can have expectations. You can plan for it instead of being in that rush season toward the renewal, which is going to make it a lot more difficult.
Yeah, you got to start the conversation early, and we can quote off of current just so you can see what's going on. We don't require medical questionnaires or form fire apps or any of that stuff. So we try to make it as easy as possible. If the group does have carrier reporting, obviously we're going to ask for any reporting available, but we try to make that quoting process easy because we understand you do have to have the conversation early. This isn't something you want to wait till last minute to have the conversation with the group.
Yeah. Yep. Well, and today we focused on Roundstone, but I want to make sure that I ask you the question of, like, if someone is looking at multiple different captive options, or maybe they're listening in and they're with another captive right now, what would you recommend they look at or use to help evaluate captive options?
Yeah, so you want to really consider how flexible your captive partner is. Are they agnostic? Are they only driving home one TPA, one network, one PPM? Are there relationships there? Cost? Are they building in cost containment solutions? And who's benefiting from those cost containment solutions? Are there limitations on group size or industry limitations? What portion of this, as we talked about, that 2/3, 1/3, what portion of the premium that is a fixed cost for the employer is going into the pool, and what portion is fixed? What is the average distribution that the group's seen? We've seen an average distribution of 10% of the shared layer. That's a nice number that we can talk about. And then we distributed $20 million in unspent captive premium back to employers. What's the history there for the captive that you're currently in? And size. I think size does matter in this industry. So, we have over 500 employers, 100,000 belly buttons, $1 billion in healthcare spend. So is it a small pool? Is it a big pool? I think having a big pool really helps nail home that volatility protection that most employers, small and mid-sized employers, are looking for in a solution. The underwriting results, as I mentioned, that as an MG, we do have the underwriters in-house. And so we really, are protective as to who we bring into the pool. So we're not just letting anybody in. And as a participant in the pool, you should appreciate that. You want to appreciate the fact that we're getting underwriting profits, but we're also very protective as to who we let into the pool. You don't want a bunch of bad eggs in the pool, right? Because then the pool won't perform well. So those are just some questions I would ask as you're evaluating different captive options.
I like that. And I'm going to give you a last little plug here, because I like this report that you sent me from 2021. And this just shows like how well employers in the captive performed versus fully insured. So if you're wondering, if you're a little bit scared about that risk, you're really, to be honest, you're taking a riskier pathway by just staying in that fully insured market, right?
Yeah, I often say, what's riskier, going into a pool where you could spend less than what your max cost is? As you can see here, I love this graph because it really shows that we're not buying business, right? We're not undercutting the market so that we can jack groups up the next year. This is showing where groups, that green area is the expected cost. I mean, which is good. That's what our underwriting numbers are showing, that groups are coming in and around expected. But look at how many groups fell underneath that expected. That's the story to tell, because those groups really benefited from, obviously 2020 was a unique year, but I've seen this year over year. We have updated numbers to show that our average group is performing 6% better than the expected. So that again, it goes to show that our underwriters are doing a good job on their end. And that this can be a long-term solution for small and mid-sized groups in this. In these past couple of years, returning double-digit increases, you want to talk about the impact that an advisor has when they're walking a check into the employer's office and saying, guys, this is why you did this. Is because this, the captive that we recommended, we took the risk. It is a risk. I'm not going to sugarcoat it. You took the risk, you entered the captive, but because the captive that you're in is performing well, you got to check back for unused stop loss dollars. I think that's the fun part of this, and that's what makes it a celebration, right? This makes insurance fun.
It's much better than delivering 15 to 20% increases, right?
You got it right, exactly. In this solution, any self-funding, it really makes the renewal season a non-event, because the group knows exactly how they're performing and how they're doing. So there's no secrets or surprises as to how things are going.
That's a great point. Well, I promised people 30 minutes. I went, I think, a minute and a half over, so I apologize for that. But please type in your questions. Reach out to, connect with Eddie on LinkedIn, me as well, if you're not already connected with me. But go ahead and reach out to us if you're interested in learning more. If you want a follow-up conversation, if you have questions you want to talk through, we're here to help you, and it's a perfect time to look at a solution like this.
Thank you very much, Jess. Appreciate it.
You're welcome. Thank you, everyone.
Have a good day.